I know we talked about this over email, but I honestly have been thinking about doing this episode for really like a year plus, and
So
it's
glad.
the most requested topic from my community because I talk about motherhood a lot, but then in my general life, like what I'm experiencing every moment of every day, and people can see this through my content, as I just said to you, it's like my brain's in 10,000 places at once. I am constantly working my ass off to bring my brain back to focus, which is really something I want to dig into with you. So ADHD is very prevalent in my content if you consume it, whether I'm talking about it or you're just witnessing it.
Witnessing it. Okay.
I'm constantly trying to land the plane. I'm like, land the
Not
fucking
telling,
plane,
just showing.
go back.
Okay.
So I want to get into everything.
Yes.
But I want to first talk about Mavida Health because what you have built is truly so incredible. And if anyone is new here, but really the people who have been a part of my community, like what you've built is really what I believe we all deserve.
Yes.
And it's so organically aligned with my mission and my content as well.
Yep.
So for people who have not heard about Mavida Health, what is it?
Yeah, so I'm a women's mental health expert, but we are often in private practice, and that's what I was. And it was very expensive, out of network, really not accessible to most people.
Yeah, I'm the client.
And I was so sad to hear all of these emails of like, I need this care, but I need it to be a network. I need it to be affordable, or I'm in a different state. And so after like so much of that, I'm like, someone's got to do this. And I've been doing this before I had children, but then I had children, had my own bouts of postpartum anxiety, and then had a really devastating second trimester loss. And
I'm sorry.
I had difficulty finding care. And I'm an expert. So I'm like, this is so hard for everyone to navigate. And there is something about specialized care during this time and this transition that's so essential. So that's what Mavida Health is. It's a virtual, specialized, comprehensive platform really for the whole path to parenthood, from trying to conceive, pregnancy, postpartum, and pregnancy loss. And we talk a lot about anxiety and depression during this transition to motherhood, but not that other things are happening as well. So ADHD is still happening and sometimes getting worse.
Yes.
So it's potentially substance use is happening, and we treat it all.
Okay.
Right? People have diagnoses of bipolar disorder, or maybe have something very serious called postpartum psychosis. We help with all of those things. But ADHD is actually something we treat, and it often is neglected, or we just don't talk about it as if it goes away when you're pregnant or postpartum.
I feel like we heard about it when we were younger because it was like, oh, who got extra time on their tests?
Right.
You know,
right.
like in middle
right.
school or high school. And then in college, because it was like, who has the Adderall?
Yes.
Because we were all just
Yes.
like, not all, I will say. The people I was around and majority of people I know in college were wheeling and dealing it.
Right.
And we're all just
And
trying.
using it for performance enhancement. But some
Totally,
people were like, oh, wait. This is
some people really needed
Yes.
it and had a
Yes.
prescription, and others, myself included,
Yes.
were using it to either party or like last minute
Right.
try to work session cram.
Right.
So I feel like we talk a lot about ADHD in those fields.
Well, you're touching on something really important,
Yeah.
which is kind of historical. Even when I was training, it was something that only child psychiatrists
Right, that's what
saw.
I'm saying.
It was like a children's diagnosis.
And then it was just kind of forgotten about.
Right.
And then what I'm witnessing now is through my own experience.
Yes.
And not even necessarily in the beginning using the terminology, but just sharing my everyday online, I'm exposed to so many people, which is such a blessing and a curse. But so many people responding to me being like, hey,
girl,
do you know how bad your ADHD is? And
we're laughing, but
it's real.
Yes, yes.
And also speaking with other people who are experiencing the same thing. And I'm realizing, yes, like I am in it, but so are so many other people.
So many other people. And
that's why I want to shed light on this conversation. So like at a very base level, I want to start off because I think I don't know the answer. Can you explain the difference between ADD and ADHD?
Sure, that's a great question. ADD is just an outdated term.
Okay.
So that's attention deficit disorder. It's something that we used to use And listen, these are experts that kind of bring about other terminology.
Mhm.
And now the real term, the one that's in kind of the psychiatric Bible called the DSM-5, and what we code for is
Mhm.
called attention deficit and hyperactivity
Okay.
disorder. But they all have similar components. And what's important is that there's different subtypes. And some of them have hyperactivity, but some of them don't. And I think what's happened is that women and girls tended to be underdiagnosed
Right.
because they were really focused on those hyperactivity characteristics, which are more characteristic of boys, right? The boy that's running around, that's
Mhm.
fidgeting, that can't sit still. But for women, it can manifest in different ways. And what we're seeing more now is that, right, because of high intelligence, or maybe they weren't showing the hyperactivity, a lot of people just like kind of went through life. And in adulthood, we're starting to, like, the wheels come off
Yeah.
as more stressors are added on.
Yes, and I even think back to my story when I was younger. I didn't necessarily have the hyperactive. Sure, I was an active, energized kid, but I wasn't, like, unable to be
Right.
contained like what we saw
Yeah.
as the poster child of ADHD. Mine was more like every teacher, she never stops talking.
Yes.
Like,
Right.
I cannot get her to pay
Yes.
attention.
Yes.
I cannot get her to focus.
That's very
She
classic.
can't understand. She's reading something, and it's as if she didn't read the page, the
Right.
next page, because
Yep.
she has no concept of what she just read.
You're like, all these are classic
Mhm.
signs, and you
Oh,
were
yeah.
lucky
A
enough
poster
that
child.
someone said, "Hey, I think this is what's going on."
Yes. However, I feel like once I got the diagnosis, we tried medication, I think, and I remember not really liking it, and so then we just kinda stopped.
Yeah.
And this is where I'm at right now and what I wanna dive into, because I think this is where so many of my listeners are.
Yeah.
Whether we've been diagnosed or not,
Mhm.
it's our norm.
Yes.
So my brain has found ways to sometimes cope, and I wanna get into coping mechanisms.
Mhm.
But I actually just emailed my psychiatrist yesterday, and I said I wanna push up our meeting, because typically we're, like, every 6 to 8 weeks for
Yeah.
my prescription for anxiety medication, because I really wanna have the discussion again about going on medication, because I think I've hit a breaking
For
point
ADHD.
for
Yeah.
ADHD,
Yeah.
because I think I've hit a breaking point where I don't wanna live like this, and there's that, but then on the flip side, like you said, I forget if we were recording or not, but it can be our superpower.
Yes.
Part of me is like, what if I lose my spice?
I know. Well, and I think this is really interesting. You
Yeah.
said something about how to cope. And it's
Yes.
coping with this world that thinks in a different way, right?
Mhm.
That's very goal directed. And in some ways, we can think about this as a neurodivergence.
Mhm.
And that people who have this kind of brain do have some more sort of creative spice and things that are interesting, but it's hard because it doesn't fit into how things, right, with deadlines,
Yeah.
with things that are expected of you. And so, what I think is really important is that even if you try a medication, if it's not working for some reason, you don't have to stay on it. It's
I
not
know.
permanent,
I know,
right?
and I know that.
Right.
I
It's
tell all
very
my friends
different
that.
from SSRIs that are like kind of working in the background.
Mhm.
A stimulant, which is the most effective medication for ADHD, though there's non-stimulant options,
Mhm.
gives you an opportunity and it goes away.
Right.
It's not there the whole, even the whole day, which can also be
Okay.
a bad
I was
thing.
gonna say that's scary
Right,
to me.
right. But I think it's about understanding, right, what are the superpowers that you don't want to lose, and kind of like what can you trial a little bit of what it's like.
Mhm.
And everything is a give and take.
Yeah.
But perhaps, right, in this phase of your life, you have so much to juggle that it may make sense. I also want to
Yeah.
say that people who have untreated ADHD can also have depression and anxiety.
That was my next question. Is that a common thing that you're seeing?
It's so common. And for some people, it may mean actually going to the root of the problem, which may be the ADHD. And again, because the expectations are such in this world that you do have to perform, or you do have to
Mhm.
finish deadlines, or have like some executive functioning. And so for some, it can alleviate those other symptoms, but for others, they kind of like move along
Okay.
together. The other thing that's really important about ADHD is that, unlike depression and anxiety, where therapy does really well, and sometimes for mild to moderate depression, for example, can outperform a medication,
Mhm.
stimulants outperform any therapy when it comes to ADHD. It's just a very unique situation.
Yeah, and therapy, look, I'm in therapy. I've been in therapy for 5 years, but, yes, it doesn't necessarily help my ADHD. What are some non-medication ways that you have found help ADHD?
It's really about planning, training, timers, right? Like having a schedule, trying to go back to it. But it's a lot of like, it's hard work.
It's
It's
so
almost
hard.
like
It's
training.
really hard.
It's training like you're training, weightlifting.
Mhm.
You kind of have to go back to the same thing, right? Or a dot when you're starting to go off into another place, kind of coming back to the present in some way, some grounding techniques. And of course, timers can be so, so useful, right?
Mhm.
Like I have 20 minutes to do this laundry. The timer goes off. I need to go on to another task.
But what if you're not done?
Right. It's really hard.
Like you actually say you
Gotta
have to move on.
Move on.
Okay.
But again, a lot of these strategies are challenging. They can be helpful, but sometimes it doesn't do the trick.
Okay, so timers.
Timers, I think really like if you want to in your calendar say like this is the time I'm going to do
Yeah.
laundry. This is the time I'm going to cook and really try to follow that, but it's hard.
It's
And your
so
brain is
hard.
going in other directions and
Right.
doesn't want to be boxed in that way.
Why are we seeing so many, well, I'm seeing, I kind of assume you are too,
Yes.
so many mothers suffering and struggling with ADHD right now, whether diagnosed professionally or
Well,
self-diagnosed?
this one's a little complicated because I think it also has to do with the contextual factors of like parents have so much stress.
Yeah.
Right? The Surgeon General just came out with a
No,
report saying,
truly.
right,
Crazy.
that being a parent in this country is hazardous to your mental health. But you imagine having to juggle the mental load, right?
Mhm.
Work, all of these other responsibilities. What starts to happen is all of those things really stress, right, the executive functioning, your organizational skills. And it's hard. And I think in some ways, if some of that was alleviated, maybe there would be room for more flexibility or, how come for you it's now that it feels so urgent
Mhm.
for medication? Like, is it the stress?
Why?
Two children.
For me, it's, well, yes, my life is very overwhelming right now, but it's less that. It's that I am quite honestly terrified at the idea of anyone having an inside look into my brain because I think I put on a really good front of like I have my shit together. I mean, I don't think I totally put on that front, but I think from the outside it looks like everything's kind of working up here.
Yeah.
And like I stay up at night sometimes being like, if someone had an inside look into this fucking circus,
Yeah.
like I honestly could cry thinking about it. The other thing is
It feels overwhelming.
I'm so constantly overwhelmed by the 10,000 thoughts that are happening.
Yeah.
And it takes
Like
so
the speed is
much.
so fast.
And
Yeah.
yes, it takes so much effort for me to accomplish what I want to accomplish.
Right.
And I go into such paralysis, which I
Yep.
want to talk about,
Yep.
where literally last night I was hitting a break of paralysis. And I was like, my husband was watching a football game on the couch. And I said, I need you to come over here and just hold me so I can cry. And like, I hate that I have to rely on him, where sometimes, especially after the kids go down, this is when it's the worst for me.
Yeah.
I'll be like, I need you to literally, my eye's twitching so berserk right now. It's been a week and a half.
Oh.
I need you to hold my hand, quite literally,
Yeah.
walk me upstairs, sit with me and force me to brush my teeth, force me to do my skincare,
Take care of yourself.
force me to get in bed, like to not get distracted by all of the other things I want to do.
Yes.
And I hate putting that on him,
Yeah.
quite honestly.
Yeah.
And then the last thing is, I feel by the end of the day, when I put the kids down and they go down around 7:30, I then work for a good hour and a half, 2 hours.
Yep.
And at the end of like the second half of that work window, my brain does not function the way that I believe it's capable of functioning at all. And I feel as if I've been drugged, and I haven't. Like
Yeah.
there are nights where, yes, I enjoy cannabis,
Yeah.
but like this is when I'm sober.
Yeah.
And I think it's because
Is it like foggy?
it's foggy, it's slow, I can't remember things. I really believe that by the end of the day, I am so utterly exhausted from trying to constantly loop myself back to the present that my brain is fucking fried.
Well, in some ways, it's forcing your brain to think in ways that it doesn't typically, right?
Yeah.
It's like in this way that that's not your natural
Mhm.
state, but it's what's required to keep your kids, right, safe and nourished.
Truly.
Right.
That's what it is.
Right.
And I think one thing for me that I equate it to is I was literally on a train the other day to DC, and I say this all the time that I would be that's a whole other thing I want to talk about.
Okay.
I say this all the time that, like, I would be so terrified of myself if I was watching it from bird's eye view of me on my phone or computer because of the way that I go back and forth between 10,000 things.
Yeah.
I'm sitting on the train, I'm sitting directly next to this woman who's around my age.
Yeah.
She sat on her laptop and worked on one document the entire 3-hour train ride.
You couldn't do that.
I was watching Tell Me Lies. I was listening to an audiobook when the Tell Me Lies Wi-Fi wasn't working well enough. I was responding to DMs. I was preparing content for the trip.
Right.
I was going through emails. I was literally 10,000 things between my laptop, my phone, and my Kindle was out.
Yeah.
And I'm just like, why the fuck is your brain like this?
Mm-hmm.
So that's my story. Yeah. But, like, I know you...
I also say, like, you're capable of these really fantastic things because your brain is like that, but I understand.
Totally. And that's what scares me about the medication.
Right.
Will I lose my ability to do everything I do? I don't think I will either. No. I know we talked about, like, the correlation of motherhood and ADHD, but are you seeing a lot of cases where motherhood is exacerbating this?
Oh, yes.
And why? Because we're just putting so much more stressors on our plate?
Well, I think there's the invisible load that keeps adding on, but I actually think that there's a hormonal underpinning to this. Mm-hmm. I think when your hormones are shifting like they are in pregnancy and then certainly in the postpartum with that sort of decrease in estrogen, there is obviously going to be brain issues and brain fog. And actually, we see this in perimenopause.
Interesting.
When we're sort of really, our hormones are changing so much and we're kind of having less of those sex hormones, we see that perimenopausal women have a lot of brain fog and sometimes their ADHD symptoms kind of pop up. But I think that there's sort of a hormonal underpinning here as well as the stressors, but I think it makes it worse. And so it's really interesting to me, the phenomenon of, like, and listen, everyone has to make their choice, and I call it a risk decision. But for example, people who are stable on stimulants, when they are trying to conceive or become pregnant, every doctor's like, well, get off of that medication. When actually the studies demonstrate that you can safely be on a stimulant. Mm-hmm. Our old studies are on people who were abusing stimulants and methamphetamines, which is very different from people who are using them appropriately. But it's like even OBGYNs talk about it as if it was like an optional medication. And listen, for some people, they're using it for performance enhancement. Mm-hmm. You talked about college. When, like, I procrastinated and I was partying and then I needed to write my paper. Or I want to work 16-hour days because I'm trying to become a partner at a law firm, but I don't need it. But people actually need it to function. Some people need it to drive safely without getting into an accident. And to kind of say that that's like a choice. Like, oh, you should just stop that.
Well, that's what frustrated me so much around a lot of the discourse on other medications when it comes to pregnancy because...
even SSRI.
Yeah, my SSRI. I was on sertraline through both of my pregnancies and breastfeeding experiences, and I will say that loud and fucking proud because without my sertraline, specifically the first round, I would not have had a full-term pregnancy. Yeah. You know, like, it's been shown that the mother's mental health and general health is the most important thing.
Like, beyond, you'll have bad outcomes.
Right.
There's preterm delivery, like you just mentioned, increased risk of C-section, and mental health is the number one complication of childbirth. Mm-hmm. And, like, we don't talk about it.
It blows my fucking mind. And they're like, by the way, you can't drink. Right. You can't have any cannabis. Right. You can't do XYZ. But don't be anxious. I'm like, bitch, you just took all of my modalities to help with anxiety.
Yes, that's right.
Like, hot yoga, like the randomest, not randomest, but so many things. When it comes to the hormonal impact, do you ever also see, this is a selfish question, but within our cycle, is there a change? Because 100%. I get very depressed when I ovulate, and I'm wondering if I also have an uptick. I haven't tracked that aspect of my ADHD.
That would be important. But sometimes people, just like they have premenstrual symptoms before their period typically, so in the luteal phase, they often also have more difficulty with executive functioning, but it is individual for everyone. For you, it seems like ovulation is
totally. I'm fine right before my period. Right. I'm like, sure, whatever.
But I think that's really meaningful. And what's great about kind of the specialty that I'm in is that we're finally kind of saying, oh, hey, these sex hormones might have some impact on mood. Yeah,
You think?
duh. Because and women in their reproductive lives have 2 times increased risk of anxiety and depression.
Mhm.
It's obvious that there's a connection.
Right.
And yet, like, we don't talk about it
Mm,
because we're basing everything on studies done on men.
mhm.
But I think it's so important to track your cycle, to talk about the differences with your
Totally.
physician. Unfortunately, a lot of women will get gaslit as a result,
Oh, yeah.
right? Oh, no, that there's
Yeah.
no connection. But I think it's important to persist and to advocate for yourself. And I'm telling you, there's definitely a connection.
Yeah.
And it's important. And I always say to my patients, you're the expert in your body and your brain. You
Mhm.
tell me what's happening.
Right, I'll have people on the internet be like, "No, when you're ovulating, you feel sexy," and I'm like,
Like,
"Girl,
not me.
let me tell you,
Yeah.
no.
Yeah.
No, no, no."
No, no.
I'm about to sync up my natural cycles with my husband's calendar. I honestly was, like, thinking about if there's a way to do that,
I
because
think
like,
there might be a way to
there has to
yeah,
be,
right.
because I get so depressed when I'm ovulating that I need him to, like
Support.
I don't wanna put that all on him, and
Right.
he's aware of it, but it would be just even better for us to prepare.
But even that, there could be like interventions of maybe exercising more during that time,
Mhm.
drinking less alcohol.
Yeah,
Like,
I don't even drink. I'm like,
okay,
I cut that out.
well,
I'm
good for
trying to
you.
do anything
Good
I
for you.
can.
That's great.
It's changed my life.
Yep.
You've mentioned executive functioning
Yes.
a few times.
Yeah.
For anyone who has not heard that term before,
Okay.
what is executive
It's
functioning?
being able to sort of organize things and be able to like execute them in a sort of organize. It's like planning and executing. Basically,
Mhm.
it's that part of our brain that sort of knows how to do different steps of like, okay, what are the steps to go? You were in DC recently.
Yeah.
Right, you got to buy the ticket online. You got to know what time it's
Know
at.
where your hotel is, which I
Know where your
didn't.
hotel.
Didn't
Right,
even know if
you
I
have
booked a
to know
hotel.
what time to get there. And there was a post you said
Okay,
about
this is the other thing I want to talk about. Okay, so within executive
so anyway,
functioning,
it's
yeah,
getting. I'm
go,
gonna.
go, go.
It's getting through all of those steps and successfully getting to the place where you
Okay,
needed to go. That's like a really basic kind of concrete example.
okay. Is it also, I'm just putting it in a tangible example of like motherhood or parenting, knowing, oh, my kid's about to be in size. I talk about clothes because it's truly the bane of my existence for
It
children.
is.
Oh, my kid's about to grow out of 6 to 9 month and move to 9 to 12. You know that. You know you have to do
Advanced
things.
planning.
You think about it, but then you never actually buy the
Uh-huh.
clothes. So that buying the clothes
Right.
is like that last
Right.
task. Okay.
Exactly.
Within, I don't know if it's within executive functioning or if it's separate, but someone asked about time blindness, which I had never heard that term before. Have you?
I've heard of it.
Okay, I
I
guess
don't use
that's
it, but
applying to what I did, where like I got up, for example, on this DC trip. I was up at 5:45. I was by myself in my hotel room, so like I had all the fucking time in the world comparative to what I normally have with
yeah,
2 children
yeah.
at home. My train was, I think, at 8 a.m., 8:10, and the way that I had to sprint onto the train right before the doors closed.
Yeah.
And I'm like, why do I do that to
I
myself?
know.
And I noticed that this has gotten really, really progressively worse after having kids.
Yes.
I don't know if it's that I just can't comprehend that I'm now responsible for also other beings getting out the
Well, they're
door.
taking
Although
up
that was just me,
space.
so I don't
They're
know.
taking up space in your mind too. Like,
Yeah.
there's just a lot to juggle there. But I do think, again, there might be a hormonal component to this. But this is exactly right, where you're probably thinking to yourself, or I'm putting words in your mouth, but like for many, it's like a self-esteem issue. Like, God, I'm lazy. I'm like, why am I not just like
Why?
getting this?
Yeah.
Like, am I like dense? What's so hard about that? I woke
Truly.
up on time. Why am I not at the train on time?
Yeah.
And it's because, again, I think you're overextended and you are having difficulty with this very clear phenomenon that
Mhm.
happens for ADHD. So sometimes naming it can help people feel and give them permission to be like, oh, wait, there's nothing wrong with me. Like,
Yeah.
there's nothing bad about what I'm doing, right? This is simply part of this sort of way of thinking
Mhm.
that, again, gives me some really cool things, and I'm empowering I'm connecting with other people. I have all these creative ideas. You're a creator. And
It's
yet,
funny though, I don't feel creative,
okay.
which is
I'll
just
tell you, you are.
personal.
Because I follow you and I
Well,
think it's
thank you,
creative.
but yeah, you have superpowers
Yes.
of
But
sorts.
they make it difficult to cope with what's required of you.
Yeah, I think that's definitely the hardest part. Speaking on that, something that I'm personally working through right now in my relationship, and I know many other people are, is like how to correctly verbalize this to a partner for them to understand, because it's really hard to fully get it.
It feels like you're not pulling your weight or something.
Yeah.
Yeah.
And like, I have the most incredible, involved, like 50-50 partner. And for an example, getting out the door. Like when I am alone getting the kids out the door, we are always late. Always. And he's always 10 minutes early when he's getting the kids out the door. And that's like a very small example, but even just the things of me being like, okay, this is a perfect example. There is a sticker on our garage door. He's going to die listening to this. That when they renovated the garage, they put in a new door and there was like this sticker on the glass, whatever. I guess they tried to peel it off, or someone tried to peel it off and it didn't fully
Like
peel.
of the brand of the
Yeah, and you know how then there's like that underlayer of the sticker? So he's like annoyed by it. And he's like, how do we get this off? And I was like, oh, I can do it. I'll just do it with a blow dryer and like one of those things. Yeah. And he's like, okay, great.
Or acetone?
That was 5 months ago.
Oh.
And I think for him, it doesn't bother him enough that he will just do it, because there are things that I don't do. And if they bother him enough, he just takes the ownership. But I almost think it's this thing now where he's like, you said you were going to do it. And I know I'm supposed to do it. Yeah. And it's technically on my list of to-dos. But I'll never fucking get around to it if we're being honest. Yeah. So like that, it's not out of laziness. It's really not. And I tried one day, but I blew the circuit in our garage. So then I just gave up. Okay. It's really out of just like,
well, there's so many other things.
I can't get myself to focus on that. Right. It's the low-hanging fruit that feels so intense, like buying a new razor for me. Yeah. It was 6 months of not having one because I was just like, I can't. Yeah. I can't. Yeah. Why do we do that?
Right.
Why?
Well, again, I think it's in some ways your brain is prioritizing the things that are most important.
Yes.
The sticker on the garage door is not, right, a make it or break it.
Thank you.
Right? So thank you. So but I think what you're getting at is like, but I want to be able to do those things, and those things kind of start to eat at my self-esteem a little bit. Mm-hmm. And that's where I think it's an individual decision about taking medications, but often medications can help you actually look at a to-do list. Mm-hmm. Not like write things on a million different places, but like be consistent with one, cross things off, and kind of execute in that way. And again, for a lot of people, it can help with their relationship because, I mean, we haven't talked about all the symptoms of ADHD, but there's also sometimes difficulty listening.
Yeah. Well, okay. Let's get into that. And then let's like loop back to how to properly explain this to a partner.
Oh, yes.
So symptoms.
Yes.
What rattle them off?
I mean, there's so many. So obviously there's this difficulty with planning. Mm-hmm. For some people, there can be hyperactivity, right? Mm-hmm. Of just not being able to sit still. There can be interpersonal difficulties. So where it's hard because you have so many thoughts, it's hard to let someone complete their own thought, you know, like wanting to be like, okay, here's what you're trying to say.
I'm going to clip this for all the people that yell at me for cutting off guests in a few of my episodes, because there are some episodes where I get so excited that it's hard for, I'm just
you have a lot of things in your brain.
I'm trying to have my mouth is trying to keep up with my brain.
Right. But our culture will say, she interrupts people. Mm-hmm. She doesn't let people finish. She doesn't let people talk. And for some people, it can feel like, well, what about my voice?
Totally. And I get that. I will leave scenarios sometimes and I'm like,
I talked a lot.
Why couldn't I just shut the fuck up?
Right.
Okay.
And so I think that's a really great example. And that can be pretty like challenging in a relationship because it can feel like one person sort of hogging it with all of their thoughts and their kind of constant train of excitement, whatever it is. But often, you know, the partner want someone that can listen, and be attentive and attuned, and that can be difficult.
Yes.
So there's some of the many things that we could talk about.
And what do you give advice on, or how do you find it most effective to try to explain this to someone who doesn't have ADHD? Because I think it's really hard.
And I think the best thing to do is just to talk about my brain may work a little bit differently, I think, right? I have all of these things coming in my mind, and you have a nice way of explaining, like, I have a million thoughts in my head. So it's really hard, or even how you described what it was like on the train compared to the person next to you, of like, it's really hard for you to sit still and kind of focus on one thing. And
Mhm.
if you even explain what that experience is like, and it feels kind of overwhelming, sometimes we call it a monkey brain, right?
Yes.
It's just like jumping from one thing to another without like that consistency. And when you start to reflect that in a vulnerable way, I think partners or friends and loved ones can start to
Mhm.
understand. What becomes hard is the decision of whether, well, so then what are you doing about it?
Yeah.
Right? If it's affecting these parts of your life, is it worth kind of examining or exploring what a medication could feel like?
Mhm.
Could it be more organizing? Or could you find out, well, my creativity is a little bit stifled and that's not something that I want? But I'll tell you, for most people that I've treated with stimulants, it feels really organizing and the creativity doesn't necessarily go away. They're just able to execute on ideas that they have. It's not
Right.
like 5,000 good ideas without anything that actually comes to fruition.
Like my note app. Um, and what about best ways to support a partner going through this for anyone who's listening? Because I know some of my listeners may have partners, male or female, who are
Yes.
in my shoes. And I know that a lot of people will listen to these episodes who feel like me and send it to their
Oh,
partners
I
and be
love that.
like, this is what I've been trying to say to
Yes.
you.
Oh,
And it's the kindest messages I get
yes.
are from these little boys. They're not little, but like husbands
Uh-huh.
a lot of the time who
Really.
will message me being like, my wife always says that like she really resonates with you. So I listened to this episode and it was so helpful for me to
Oh,
like hear how her brain works.
that's fabulous.
And I'm like, you're great.
Right. That's
But
really fantastic.
what is the best, or not the best, but what are ways to support people going through this?
I think it's always important to be curious.
Mhm.
That's what I always lead with, of like, if it's like, oh honey, that sticker's still in the garage. Like, what's going on there? Right? Tell me more. Right?
It's a fucking sticker.
Right? Can I somehow collaborate with you? How can we figure out a way or a system for our family or our partnership
Mhm.
that could be useful? Right? There's shared calendars, there's things like that that can, right, when one partner is better at those things, then they tend to
Yeah.
come together. Right? You tend
Yes.
to not come together with a partner who's exactly like
Well, because I
get
don't
everything
think you
done.
would, yeah, you'd never end up at the same
Right,
place. Like
right,
no one would
right.
show up for a date.
Exactly, exactly. So you tend to find a partner who has those strengths or
Mhm.
those skills, and even being able to, oh, how do you keep organized, right? Like, what lists are you using? Oh, is that a new app? Should I try that? Like, I think that's a way to feel really collaborative and even say, oh, I heard on this podcast, or I heard on I know TikTok's now
TikTok.
the new mental health resource,
Yeah.
that this may work.
Mhm.
Is that worth talking about? Is that worth exploring? What would be the side effects? I think it's like the curiosity is
Yep.
always what's important. I think the accusation of you have ADHD and you need medication is not going to
Not gonna help. I will say, like, the other thing is when you're the partner, you're observing this person throughout so many different phases of their day or week or year or whatever it may be. And so knowing, like, where they're having a hard time, for instance, Joe will do kind of what I said, where he's like, "Shut the computer,
Yeah.
go upstairs,
Yeah.
get in the shower,
Yeah.
take a shower." Then,
Get
like,
present.
stand with me and be like, "Okay,
That's great.
we're gonna do this."
That's great.
And I'm, like, embarrassed to admit that I need that, but a lot of nights, like, I just need someone to literally guide me through actions to stay on track
Mhm.
so that I don't go off into 100 different tangents. Because what it feels like in my brain, and I do equate this a lot to anyone listening who doesn't experience this, it's like having 1,000 tabs
Oh, yeah.
open on my
That's
computer
exactly what it is.
and
I love
having
that.
someone switch the tab every
Yeah,
10
yeah,
seconds
yeah.
and not
You
having
can't
control.
focus on anything. You can't, right. And this is why often people with ADHD lose everything, right? Forget to
Mhm.
pay bills, do all these things. And they're not, people are like intelligent, responsible.
Yeah.
And yet, right, I think that is such a good description of it. It is having a bunch of Google tabs open and
Truly.
like not being able to kind of finish one out.
No, never. I mean, truly, if you look at my phone, I have 10,000 tabs and they're never finished. It's amazing I really get anything done, quite honestly.
You were here on time.
Shocking.
Okay.
No, I actually am very good if it's someone else's well, other than my therapist, I'm consistently 5 to 7
But
minutes late to
that's
therapy.
your time.
Yeah, but if it's someone else's time, that I
Uh-huh.
take very seriously.
But
As
that's
seriously as I
interesting
can.
with therapy going late. I actually do too.
Why do we do that? Is it so that we don't have to do the full 50 minutes?
I think there's something there about like caretaking and not like it kind of ignoring your own needs.
Yeah. Honestly, for me, I also cram so much into every possible window that I don't give myself time to, like, get from one
Transition.
place
Yeah.
to the
That's a
next.
great example. Right. Transitions can be really hard.
Really hard. Really, really hard. The other thing with completing tasks is this, like, task paralysis.
Yes.
Can you explain why this happens? And I guess, like, what it looks like? And I can also obviously explain what it looks like
Your
for me,
Google
but
Chrome is frozen
yeah.
because there's so many things open, right? Like that's exactly what it is. But I think in some ways it's having so many different directions and not having difficulty choosing a path
Yeah.
forward, right? Like I'm gonna go forward and finish dinner,
Mhm.
not laundry and all this stuff. And I think, I also think it's stress, frankly, and then the whole kind of perfect storm comes together, and then you end up not doing anything at all. And this is often what I hear of like, or just like sitting on a couch, zoning out,
Yeah.
right? Or scrolling or watching mindless TV. Because in some ways, your monkey brain needs some rest. And I think in
Mhm.
some ways that's what it's searching for. And freezing is a little bit like that, but freezing can also, and you'll tell me, road is self-confidence, self-esteem, kind of
Mhm.
like like what am I doing here?
Yeah.
It's like wasting my night away,
Yeah.
rotting on the couch.
I mean, for me, it's definitely my books,
Mhm.
not the paralysis. I will have the paralysis. I had it exactly last night. Like, there were so many things that I knew I needed to do, and feeling like I'm so overwhelmed with the
Mhm.
idea of even starting one.
Any thoughts around that? Because starting one, what would do what?
Um,
Maybe
it
the
just
wrong one?
no. Okay, I'll, like, give you the full example. So, basically, I feel very overwhelmed in life right now because A, managing 2 children, but B, there's just a lot of work stuff happening.
Yeah.
There's in terms of work, like, with content, I'm never like, "I don't know what to do to film. I don't have enough things to say." I have
Yeah. I
10,000
imagine.
things. So, it's trying to actually, like, get them all out there and, like, when it's gonna post. And then I have this upcoming live show, so, like, there's so many moving parts to that of, like, tickets, we need to make sure I have the guests, when are we gonna promote the guests, booking the makeup, like, little things, what am I gonna wear?
Mhm.
That kinda stuff,
Mhm.
and then we're launching a product in 2 months, so it's the 10,000 things leading up to that, so it just felt so, like, there's so much I have a hard time with future stuff, if that
Yeah.
makes sense, like,
Yep.
knowing that there's gonna be a lot.
Yep.
If you said at night, the dishes need to get done, the beds need to be made, the laundry needs to get put away, like, I'm good at that kinda
Those are like
stuff.
concrete.
It's
They're here and
concrete,
now.
tangible.
Uh-huh.
It's more of the, like, I get so overwhelmed by future tasks or things that I can't necessarily do right now. Like, I can't do this photo shoot right now.
Right. But
Do you know?
what's tough is that you have all these like what sound like fantastic things going on that you've probably worked so hard
And
to
that's
do.
what makes me angry.
Yeah.
I get literally angry. This is turning into my therapy. No, but I get angry because it's things that, like, I'm living
Want.
out what I've always
Yes.
wanted,
Yes.
and then I'm so overwhelmed.
And then the other concern is, and when you don't have a good team around you or support or you're doing things, is that then in some ways you're going to sabotage it by not having the tickets,
Yeah.
right? And so how can people show up if you didn't sell tickets?
Yes. So the task paralysis for me in that moment looks like truly and utterly frozen.
Yeah.
At my laptop and just feeling like, "Joe, can you come hug me so I can cry?" That's my paralysis.
Yep.
But then I also think there's that desire to escape, which is why I read,
Yes.
because for me, that is the one
Fiction. Okay.
Oh god, yes. Like smut, it's porn pretty much, but romance novels. Like, if we're
Okay.
being honest, I'll call it what it is.
Fair. But it's
It's
escapism.
It's escapism because I need to go somewhere that it's the only place my brain stops.
Yeah. For me, it's
Every
reality TV.
But you don't find yourself, like, grabbing your phone watching that?
Sometimes. Or doing other tasks. Yeah.
Right, see, that's what I mean, like, if I'm watching reality
Then you're
TV.
like,
I'll
it's
be like
background.
in my
It's background TV.
DMs. Yeah, like I need something that has
That
every ounce of my
captivates you.
focus so that my brain is focused on one thing.
Okay.
And that's what reading is for me.
Right.
Like
So
an
you're
edible and a
and
book.
you're able
Oh my God.
to get through. You're not reading the sentences over and over again. That's a problem for some people.
No, I get through, but I speed read.
Oh.
Like to be determined if I read every word.
There's no reading comprehension quizzes at the end.
No. Oh God.
Okay.
Well, I also read books so fast and so frequent that like 3 books later, I couldn't tell you what that book was 3 books ago.
It kind of just like goes.
And they're
down
also
the
like
tunnel.
so kind
Right,
of
it's not
similar.
worth
It's
kind of
romance. It's
holding on to. But I think that's interesting. Like those details are kind of flushed and they don't have to be. And I think in some ways that's a little bit of the monkey brain.
Yeah. But I do, well, I guess I'll ask you, is that healthy to have something? Like, is that a healthy coping mechanism for me to have at the end of the day to use? Because I truly just like desire that moment for the second half of my day where I can just like shut my fucking brain off.
Yeah, I think it's a yes and no. I think it's if it's providing what you need and you're achieving all the other things that you want,
Yeah.
then it's great to disconnect in these kind of escapist books. But if it seems to be taking over or you're doing it instead of doing things that could actually, right, that are value like aligned, that will.
But where do you draw that line? Because like I could keep doing things all night.
Yeah.
That's where I honestly think about this and have a hard time.
Yeah.
Because like it's 10 o'clock. I could keep going for hours.
Right.
Doing other things.
Right.
But I'm
this
like,
is the superpower.
You got to go to fucking bed.
You've got to.
And that's my transition to bed, if that makes sense.
Then that seems to work for you.
Okay.
As long as it's not taking, an obscene amount of time for you and taking away from doing the things that you enjoy doing, I think those kinds of breaks, and what you're calling it is a mental break for you, are helpful. And it's a way to transition. And especially when you're at home all day, it's hard to have those transition points. If you are working outside the home all day, it might be a little bit easier.
Yeah.
To be like, okay, I'm home now and this is the transition. But the way that we are now working from home or at home a lot, we need different things to like make that a transition. But if that's a transition that you don't want, then choose another, right? Go on a walk, whatever it is.
Transitions are so interesting because I think that this was a huge realization for so many people during COVID, during the quarantine, of like drinking.
Yes.
Because that was what.
There was such a huge increase.
So huge.
Young moms.
Oh my God, I'm sure.
Women, yes.
But I feel so many people have a hard time during that window of like, well, my work day's over, but I didn't leave the house. So how do I now enter into this other stage? And that's what alcohol then became for so many. And I also think that that is what kind of wine is when you talk about like mommy juice. And
that's
for
a
me,
tough one. That's a whole other podcast of like that
podcast.
really gets me.
Me too.
Yeah.
Me too. Mine comes from the personal annoyance that like people will be so judgmental of me saying I'll take a 1 to 2 milligram edible.
Yeah.
I'm like, that's not even equivalent in my body of a glass of wine.
Yeah.
So like, I know you wouldn't be saying these things if I was just having a glass of wine like everything else we're seeing on the internet. But also like that's what society is like trying to give us. Yeah, like why don't you help us?
Right, not federal paid leave.
Right.
Right.
Why don't we actually get the tools we need?
Common sense gun control.
Yeah. For me, a big transition that helps is like, and I never did this before having kids, but I shower every single night.
Yes.
And that was never a thing I did.
That's a transition.
But it's a transition of they go down, I finish my work, and then I'm like, get in that fucking shower, put on your pajamas, do your skincare, and then like have some time to yourself. Another question that.
So those are non-medication tools.
Sorry,
that can be really helpful.
Yes. Another thing I want to talk about that I talk about a ton, and I kind of assume they're related, but I guess I don't really know, overstimulation.
Yes.
What is the correlation between overstimulation and ADHD or the relationship?
I think, and it's interesting because there's, those fidget devices and there's the idea that ADHD can have these symptoms of being yourself overstimulating and stimulating. But I think for many, there is the other part of it of like what the inputs are.
Yeah.
And when you describe something like you have of how much is going on with your brain, the noises, the shouting, the other things, right? That's so many inputs at the same time. Do you have some noise sensitivity?
Awful.
Okay.
Yeah. Like, if you turn the fan over a stove, I'm leaving the house. I can't. My brain honestly can't compute.
Because it's too much.
Once that's just like such a tangible example for
Yeah.
someone. Once that goes on, it's truly like my brain
nails on
has
a
stopped
chalkboard,
working.
right?
It's not like it necessarily like the noise bothers me, because like I'll sleep with white noise and it kind of sounds similar, but it's just you can't expect me to understand what you're saying. And when I'm overstimulated, I get angry. Like my natural inclination is to fucking lash.
Yeah,
I get
rage.
irritable rage. So things like that, my
Super
dog
connected.
barking,
Yes, super connected.
while my baby's crying, like someone's phone having a sound on. Yeah, those things
It also
really
kind of
get
goes with some
me.
anxiety as well.
Totally. Yeah.
Those things are all wired, and I think it's okay to kind of ask for, let's bring the volume down. But I think in some ways, like for you, not to come to any conclusion.
Go for it, girl.
But there can be other tools in addition to what you're using and trying to turn off the fan. And like if you are sort of taking a medication that could be helpful in parsing out what's happening internally,
right?
Perhaps those external stimuli would not be as irritating. But like and for you it was probably the case when you were young and taking a test, and for so many people they age, it's like they're looking at every single stimuli. Who closed the door? Who's who's like using their eraser too loud or whatever it is, right? And that's exactly what it is. Of like there's just you're able to grasp at everything, which in some ways, and this is why we call it neurodivergence, you can find details that are pretty cool, not in that scenario, but in others.
I mean, I will tell you, I could be in 10 conversations at once in a party. And my friends are always like, how did you know I was talking about that?
Yeah.
Like they'll be sitting at a table over there and I'm talking to someone here. Yeah. And I hate this about myself sometimes because I think it feels very rude to the person I'm speaking with. But I'll be like, hold on one second. No, Jess, you did da-da-da-da-da. And she's like, you weren't in this conversation. Where did you come from? How did you even know what I was saying? So,
but in that way, there's something cool about being able to contain all of those things.
There is, but I also think it's not perceived the best. It's my husband and I being on a date and him talking to me and me being like, are you listening to this? And he's like, listening to what?
To me.
And I'm like, this girl over here is spilling the tea. And he's like, I'm talking to you.
Right.
And then what about burnout, exhaustion? Is that all intertwined because of the constant fight to bring us back?
Right. It's forcing yourself to think in a way that everyone else does, and it comes a little bit easier for other people. But for you, it's very hard. And so it's kind of training yourself to do something that doesn't feel so automatic. And that's a lot of work. It's like training.
Yeah.
Right? It's like lifting those weights. It's like coming back to what the point is. And listen, these are, again, essential in some ways because you have to get things done. If you want to advance your career, you have to do all the things that you described. But it's exhausting.
Yeah.
And I think at the end of the day, you're like, ugh, how can I turn this off and just like go in a vegetative state? And I think it's okay sometimes to do those things.
Yeah. It's interesting to me because I think about like my social battery, for instance, like after being quote unquote on in an interview, for instance, I need to like silent. Yeah. Like I shut down. And it's not, this is my favorite thing to do.
Yeah.
But I am fighting so hard throughout the entire episode. Keep focus, land the plane. Right. Get back to that.
I mean, this is also like introvert versus extrovert. Yeah. People also on this spectrum. For some people, talking in this way can just feel like, oh, that's exhausting. I really enjoyed it, but I need some solitude. But I think for you, it might be there's a lot of noise that I brought myself back to.
Yeah.
And I'm tired.
Yeah, because I feel lit up and energized by the conversation.
Yeah, I see that.
And it brings so much joy, but the mental work and load is what's exhausting. And I think
on those balance beams going on, like, okay, literally. Wait, just come back.
But I think that equates to parenting also, and this is why I think it's so interesting to observe a partner because my husband and I are very different
Mhm.
neurologically, the way we handle things, and even doing 50-50 of the load, mental and physical, like observing him, it's a very different experience than observing me. And I also think that, like, we talked about how to support and that kind of stuff, but I do think your advice of observing someone who maybe isn't struggling with this and what works for them and picking little things like
They're a
quite
model.
yeah, I mean, I get jealous of my husband because
I do too, actually.
do
My
you?
husband's better at sort of executive functioning and following through with things.
Yeah.
And even though I don't have a diagnosis of ADHD, like it can be hard. It can be hard for people who even don't, right? When
Yeah.
there's so many other things.
So many. I'm jealous because I just feel like yeah, his time management and just
Planning, executing.
planning, executing. He's cut out the stimuli. He's not on social media.
Oh,
Like,
that helps.
he was on Twitter for a bit, and I said, "You're spending a lot of time on your phone." He's like, "Oh, I'll just delete Twitter. I don't need it." And I'm like, "Wait,
He's like, I'll just
you can just
flip
do
phone.
that?" Like, just deleted Barstool Sports, deleted ESPN. I'm like, "You're
Wow.
like, he's very good
Yes,
at that,
yes,
and
yes,
I'm not."
Yes.
But I think it's very helpful to observe someone like that in your life, whether it's your partner or not.
Oh, yes.
Of like, how are you physically making this work?
I have the same problem with like, and a lot of women do, I think, when they're caregiving, especially of like wanting to watch TV, read novels, like scroll on Instagram instead of going to sleep.
Yeah.
And it's really nice to see my partner kind of have a little bit rigid sometimes of like, this is my bedtime and nothing is going to come in between that.
Yeah.
Even if we're watching a movie, it's like, okay, we're going to pause the movie till tomorrow. I'm like, what?
Wait, we just did that last night, and he was like, "Look at us. We're so cool and chill. Like, we don't need to finish the movie tonight. We'll just," I'm like, "I don't know if that's chill. I think it's a little psychotic."
Yeah, it's a little rigid.
But we did it.
Right? But but I think in some ways he's sort of saying this self-care is really essential to my functioning and I'm going to prioritize it.
But what you just said about the bedtime thing, I call it revenge bedtime.
Yes,
And it's so real with
It's
kids.
so real.
Especially I found it with a baby.
Oh yeah.
Because like when you know you're going to be up throughout the night,
Like, no, this is my time.
you're like, you put the kid down and then you know you should go to bed
Yeah.
because you're going to get up at 1
Your
a.m.
only opportunity
But I'm
to
like,
sleep.
this is the only fucking time that no one needs me. I want to do whatever that thing is. And then I'll lay there and then I'm like, well, now it's 10:30. Do I even go to sleep?
Right.
Like,
I hear this from, I have to
it's
say, like
so
every
crazy.
single mother that I treat, that I talk to, and I'm still like, the solution is to prioritize your sleep, but like I still don't know what.
I think we're all just like fighting for something for ourselves.
Yes.
I think that's what it is at its core.
Yes.
Like we just want something for ourselves and it's carving out any window where you can. I mean, it's why I get up at 5:30.
Yes, that's right. That's the right move.
Yeah, it's a wild ride. This was so freaking helpful and informative. Like I'm going to be texting you like we could do 20 episodes on different topics.
More than that. There's so many wonderful things to talk about that are largely ignored. Like we hear a lot about postpartum depression and even anxiety right now.
Yeah.
We don't hear about all the other things that go on.
Truly.
Yeah.
But I will say I'm going to leave this and be like, I talk too much. Exactly what we talked about.
It's your job.
Yeah, but still, I'm going to do that.
Interesting. Yeah. And then there's like, and again, I think over time that can affect your self-esteem.
It does. Deeply. Deeply.
And so, that's not how I received it.
Thank you. Where can my community support you if they want more of you?
So I'm at Sarah Oreck, MD on Instagram. And then Mavida Health is mavidahealth.com if you want treatment. And we're at Mavida Health on Instagram as well.
Wait, I literally forgot I was going to start with this. Yes. Thank you so much for saying that. And we're going to put, like, this is something I was actually thinking. Do you prefer to be called Sarah or Dr. Sarah?
Oh, I don't care. But you can call me Dr. Sarah.
Well, because you can say you care.
I earned it.
Well, that's what I'm saying. You went through so much schooling.
I know.
And I think it's internalized misogyny because
it totally is.
I wonder if you were a man, if I would say like Dr. Phil.
But it's like,
but he's not even a doctor.
No.
But
it's like the Hillary and Kamala Harris thing.
No one's calling them Harris. Right. It's all Kamala.
Right. Apparently that's what she likes. But
we never say Donald.
Right. Maybe we should.
Yeah, it's a whole separate conversation.
Right.
But
no, I think you're right. There's definitely But I also feel like there's something weird about it.
Well, because the reason I would call you Sarah
Yeah.
is in my head, I would say it's because I'm trying, like, we're creating a
Connect.
personal relationship and connect.
Yes.
But is that just deep rooted in internalized misogyny? Because
Like doctors
would
aren't
I,
met old men.
yeah, would I
Women.
try to do that if you were a man? I don't know. But I think about this all the time because I like refer to my therapist as Aaron instead of
Yeah.
Dr. Aaron.
Yeah.
I'm like, but that would feel so weird to call
No,
you
but it's
Dr. Aaron.
familiar. I think that's more of what
Yeah.
I think. And that's maybe my discomfort with it. I mean, my discomfort is also daddy issues. So I changed my last name. And so it was so weird to always say doctor, and my given name is Ramirez. And
Okay.
it was like, I have a terrible relationship with my father. Like, why do I want to be called his
Fair.
name constantly?
So fair.
So for me, there's always been an aversion to, like, that's weird. Like, I'm Sarah.
Yeah.
I have issues with last names.
Mhm.
And so I think on written things, I prefer Dr. Sarah Oreck.
Yeah.
And actually, there was something where recently I wasn't called doctor, and I felt like on like printed stuff, and I was like,
Oh, hell no.
I did a lot of schooling to have that taken away.
Well, absolutely. In every episode title and note of this will be Dr. Sarah. I just meant more referencing you. It's funny. I didn't actually know my dad. This is such a weird fucking tangent. I didn't know my dad was a doctor until I was like, because he doesn't work.
PhD? Oh no, he's a medical doctor.
No, he a PsyD.
Yeah, that's a doctor.
He had a completely different life.
Okay.
And then started working in corporate America in finance.
Oh, cool.
And so my whole life he worked in finance.
Oh, so,
And
yeah.
I remember being in like a phone book of something when I was like old, 10. And I was like, why does it say doctor, Mom? And she's like, because your dad has his doctor. I was like, what the fuck?
That's so funny.
So like on wedding invitations, for instance, it'll say Dr. Judson. But I think that's so weird. 'Cause I'm like, but you're not.
You're not a practicing
Yeah.
doctor.
Anyway, Dr. Sarah, thank you so much.
Of course,
This was
of course.
wonderful.
It was so fun.